Thank you for
Thank you
joining
for
us
joining
for
us
the
for the
MSF briefing
focus series
series
of
Focus.
MSF Operation
So I'm
Briefing.
Ji-hyun Bang from the Communication
I'm
Department of
Ji-hyun Bang from
MSF
the
Korea.
Communication Department of MSF Korea. I
So
would first like
currently,
to
we are
inform you
providing
that for
simultaneous
today's event,
interpretation in
simultaneous
Korean and
interpretation
English
is
throughout the event.
available. You can
So
switch
please
between
click the
Korean and
interpretation
English by
button at
clicking
the
on the globe
bottom to
button to
select the
select
language
your
if you need
language of
interpretation
preference.
service. Doctors Without
MSF
Borders
is an
is an
international medical humanitarian organization
that
which
works
operates
in
in
areas
humanitarian
affected by
crisis zones
armed
around the
conflict,
world,
disease
including
outbreaks,
areas
natural
affected by
disasters,
armed
and
conflicts,
regions with
epidemics,
limited
and
access
natural
to
disasters.
healthcare.
You will
You
hear
will hear
MSF very
throughout the
frequently,
presentation.
and this stands
It is
for Medicine
actually
Sans
an
Frontières,
acronym
which is
for
a
Medicine
French
Sans Frontières,
name of the
which is
organization,
in
and we
French.
refer to it as MSF. The
Today's
focus of
focus
today's
webinar
webinar
has
is
been
to shine
organized to
light
shed light
on
on
ongoing or
overlooked
underreported crises
to
and
provide detailed
provide more
insights
detailed
into
information
MSF's
about
activities
MSF's
in
response
those
in
areas.
those areas. In today's
So
10th
today's
focus
10th
briefing,
focus
we will
briefing
address
will
the
be
crisis
discussing the
in
crisis in Lebanon.
Since September, the
Clashes
conflict between
Israel
Israel
and
and
Hezbollah have
Hezbollah
intensified
along the Lebanese
Lebanese border.
intensified. On November 27th, there has been a
although
60-day temporary ceasefire that has
truce
been announced, but the need for
However, the
humanitarian
need for
assistance
humanitarian
continues.
assistance remains critical.
According to the International
According to the
Organization
International
of
Organization
Migration,
for
more than
Migration,
800,000
more than
people have lost their homes
800,000
and are
people have
spending
been
the cold
displaced and are
winter
spending
in
the
temporary
harsh
shelters.
winter in
And those who
temporary
have
shelters.
returned to their
Those who
homes
have
are
returned
faced
home
with
are
the
faced
heartbreaking
with the
sight of their
heartbreaking
homes
sight of
destroyed.
villages which are
Today,
largely
we will take a
destroyed.
closer look
So
at
to
the emergency
provide more
response
details
situation
on
in
the
Lebanon and
emergency
how
response to the
MSF is
crisis in
addressing
Lebanon
this
and
humanitarian
activities
crisis. To help us
of
understand the
MSF,
situation
we
better,
are
we
joined
are
today
joined
by
by
Tania
Tania
Hachem,
Hachem, the
MSF's medical
program
program manager,
responsible of
currently
MSF
working in
currently
Lebanon, is
in
with us today.
Lebanon. If you
Before
have
her
any questions,
presentation,
please
let's watch a
present them
short
in the
video
Q&A section.
depicting
But
the
before we
current
go into the
situation in
presentation,
Lebanon.
we'll share a short video.
If you have any questions during the
As mentioned,
presentation,
if you
please
have
submit
any
your
questions
questions in
during
the
the
Q&A
presentation,
section at
please
the
leave them
bottom
in
of
the
your
Q&A
screen.
section at the bottom of the screen.
Additionally, we'll be sending you
And after the event, as we
doing the
did last
satisfaction
time, we
survey
are going to
after
have a
the
satisfaction
seminar.
survey.
And if you participate in the
for the
survey, we'll
participants,
be
we will
sending you
send
the
an MSF
2025
2025
calendar as
calendar.
a gift.
So we ask for your
please,
interest and
I would like to
participation
encourage
so
you
that
to
we can help
participate in the
improve
survey.
our
It will
future
help us
events.
continue to
Then we'll
improve
take a
our
short
events.
look at the
Thank you.
video.
Today, we're lucky. The sun is shining, but winter is coming. The conditions here for those that are displaced, in a context where there are already so many refugees being supported by local communities and organizations. MSF has already scaled up its response, providing medical care, mobile clinics in the different shelters that are accommodating those that have been displaced, in areas where there's a high density of displaced and other vulnerable populations. In addition to the work on the medical side, the teams are providing water and sanitation in the different locations. And now as we come into winter, simple things, distributing blankets. The temperatures at night are freezing, and we're only at the start of the winter.
Shall I start?
Yes, you can begin.
Okay. Good evening, everyone. Korea time. It's still midday in Lebanon. So my name is Tania, and I am the medical responsible that was covering Lebanon during the first phase of the intervention up until today, and I will be providing you with a Lebanon operational update. Next slide, please. As you all know, if you are actually following up on the current context, certain information are also missing in this slide as it keeps on changing by the hour. We have been scaling up our interventions since the end of September, where there was an escalation in the friction between Lebanon and Israel. This has led to a ceasefire on the 26th of November 2024. This ceasefire is bound by a 60-day agreement where there would be an exchange. First, the UNIFIL would confirm the withdrawal of the Israeli armed forces from the border of the south of Lebanon, where the Lebanese army would actually take over the representation, the military representation at the border, which means that the ceasefire period is bound by lots of factors, and it is being monitored closely by our teams in terms of security follow-up and also operational follow-up. Since then, and days before the ceasefire, there was an intense shelling in the south of Lebanon and the southern suburbs of Beirut, and they are the red parts on the map. Following the ceasefire, mass movements of the displaced population returning to their homes in the southern suburb of Beirut and the south of Lebanon and Bekaa, where there was also an escalation in two parts of Bekaa, Baalbek and Hermel. Most of the people were returning to check if their homes are actually existing, or most of them are destroyed. We were expecting to see returnees where they failed to find refuge, and this is a situation that is continuously monitored. Destroyed health services and damaged infrastructure, increased risk of disease and outbreaks, weak water and sanitation systems post-destruction. If we want to talk about displaced populations, as you all might know already, Lebanon was hosting refugees, Palestinian refugees, Syrian refugees, and also the vulnerable Lebanese population that were affected directly by the current escalations. There was an internal movement of displaced people, whether they were Lebanese going from the targeted areas in the south of Lebanon, the southern suburb of Beirut, and certain areas in Bekaa, out of the affected areas into another safe zones in Beirut, Mount Lebanon, Akkar, and other areas surrounding Beirut. And we will talk about that later. Or they could be Palestinian refugees fleeing from the Palestinian refugee camps that are in the affected areas in the southern part of the country, where we have more than or at least two official refugee camps. And then there was the Syrian displacement. So the Syrian refugees that were residing in the south of Lebanon and also in certain parts of the Bekaa, they either fled to other safe areas in the Bekaa or went up to the north, and they were seeking refuge in Akkar, which is in the northern part of the country. When the ceasefire took place, all the displaced population, whether they are Lebanese or Syrian or Palestinians, tried to go back to their original home. What we're doing now is we're waiting for people to decide whether they are going to reside in certain areas for good, or they would come back. In addition to this, it's their decision regarding their movement and their accommodation and possibility to survive in a drastically destroyed region, plus this continuous monitoring for the 60 days period of the ceasefire to check if there is any break of ceasefire and if there would be another wave of escalations that would push people again out of their origins. Next slide, please. This is a video that we have worked on in the beginning of the escalation. It would show you some images, although it was difficult for us to get images and people didn't really want to be put on camera most of the times. Due to security reasons, we couldn't really go into so many other places and to shoot videos. So these are just images of the MSF interventions, Beirut and Mount Lebanon, where we were doing water trucking, giving access to drinking water, hot meals, food, NFI distributions, mattresses, hygiene kits, and medical activities through mobile units that were covering chronic diseases, medications refill, mental health support, and general outpatient follow-up. These are photos of group psychoeducation sessions for the children. And this is something that's not going to stop now, as this would lead into PTSD follow-up in the future. Those are pictures from distributions of NFI items, mattresses. We were supporting local organizations and groups of women in providing clean spaces and financing food preparation for the IDPs. This part covers the Bekaa region, where our teams were trying their best to access the clinics that were not safe to reach every day. One of the activities was to follow up on the huge cohort of chronic diseases that was already covered in that area and to provide access to the displaced in that zone. We move now to Akkar, and this is part of the north of Lebanon. In Akkar and Tripoli, MSF was providing the same package, NFI distribution, hygiene kits. In Rashaya, we have been positioned in Rashaya just before the escalation. Rashaya is supposed to be absorbing people coming from the south as IDPs. We opened helplines for mental health, and we were receiving requests. That was used as an assessment tool. In Tyre, we were supporting. It was difficult to access the south of Lebanon in the first couple of weeks due to security reasons and difficulties to access or to ensure safety of our teams. However, we have provided indirect support to local organizations who were supporting the population on the ground and providing hot meals to people who were stuck and were not capable of getting out of that specific zone. Next slide, please. So here I would elaborate a little bit because in the video was not super comprehensive in terms of operations, what we have done, and the change for what we are doing today and how it would go in the future. That's the map of Lebanon that summarizes MSF interventions all over Lebanon. Mostly, as I have mentioned before, people moved from the south of Lebanon, southern suburbs of Beirut, and a couple of areas of Bekaa, into other regions that are safe in Bekaa, into the north of Lebanon and Akkar, or into Beirut, Mount Lebanon areas to seek refuge. MSF provided where it is needed, and depending on what is not covered by other actors, most of the time it was NFI, hygiene kits, MMUs, medical mobile units that cover mental health, NCD, outpatient, managing outbreak of skin diseases to start with. We didn't really have so many outbreaks up until the ceasefire. Luckily, we didn't really need to do any mass distributions or management or campaigns in terms of vaccination for the time being. So after the ceasefire, all the MSF activities were concentrated on the displaced population. We have prepared before the escalation, and what we did during the escalation is ensuring providing trauma kits to the hospitals at the front line, where we couldn't really access due to intensified shelling and difficulties to access at certain points. However, we continued trying to access it whenever it was feasible, supporting the hospitals that were dealing with the fresh wounded, in terms of donations and other supports. So in terms of trauma interventions, MSF was supporting the Turkish hospital in Saida. We started the support in Babda Governmental Hospital in Babda, which was not activated completely due to the ceasefire. We have been also supporting Al-Hamshari Hospital in the south, and Tripoli Governmental Hospital, which is in the north of Lebanon. Now with the ceasefire, this is being shaken a little bit as we follow up on their challenges during the war time, and preparing for an IPREP, as the ceasefire it is bound by certain factors and it's not completely over yet. Hence, our teams are currently visiting all the hospitals at the front line, whether in the south or in the Bekaa, to make sure that we have an active plan and we could be of support to the hospitals that are actively working on that, and to be part of the stabilization process of wounded that might derive from the current context. What's worth mentioning today is that when the ceasefire started, 2 days after that, the situation deteriorated in Syria. So first, with pushing out the current president of Syria, the rebels and the parties that were existing, and some of the people that were fleeing Syria before, in the last couple of years, and they were residing as refugees in Lebanon, started going back to Syria, and another group of Syrians started seeking refuge in Lebanon with a change of the authority and feeling unsafe and insecure with this very rapid change in the context. And this has also changed a little bit our operational lens, as we started receiving lots of new Syrian refugees in the Bekaa region that are residing in Hermel and in Baalbek, and our teams are reassessing the needs of the displaced people who are returning to their areas, but also new waves of Syrian refugees. And this is also going to shape up the kind of response that we would be giving now as post-war and during the ceasefire period of time, with a very close monitoring of the context that is impacting our operations, that are really changing by the hour, depending a lot on the development of the context itself and also the movement of the population. Next slide, please. These are pictures from refugees who were seeking shelter in Beirut, in abandoned buildings, in downtown, in schools, governmental schools, and even at the seashore, where tents were set, and people were just fleeing, and they wanted a safe area to stay. So those are a couple of pictures from our mobile units all over. Next slide, please. So our response was not purely medical, as the first need for a displaced person is always also logistics. So it is about shelter. It's about having mattresses. Now that it's winter and it's snowing in certain parts of the country, it's about having blankets. It's about having access to clean water. It's about having access to drinking water. It's fresh food. It's winter clothes. People had to flee, leaving everything behind them without having prior notification or preparation, and they came as they were, and they were in need for all those items that I have mentioned before. And this would also depend on the type of the displaced population. Some of them are disabled, others are elderlies, others are young children requiring access to milk, hygiene pads, etc., etc. So now that it is winter time, and the areas that we're covering in the north of Lebanon and also in Bekaa, and now in the south with the people going back to their areas, there is a huge need for keeping people warm, knowing that everything around them is actually destroyed. So most of the work that has been done was purely logistical work to help people survive with dignity during this process. Next slide, please. So the question is, what are we doing today? And I cannot reassure you that it's going to be the same in 2-3 days, as it really depends on the movement of the people. As I said, 2 days ago, we started receiving more a new wave of Syrian refugees coming inside Lebanon, requesting a whole different approach and response in Bekaa, and it brings back memories on the beginning of the first wave of the Syrian movement after the escalation in Syria 2011. However, the previous Syrian refugees are also on the move out, but they don't really feel secure yet. So they are not really communicating their exits completely, because they would like to maintain space for them to come back. In Akkar, that it's a project that was supposed to be closing, operationally speaking. However, it kept open for its strategic positioning between Syria, but also because it hosted lots of IDPs. Today, those IDPs left back to their areas. A couple of them remained in Akkar because their homes were completely destroyed and they couldn't really establish accommodation in their areas of origin. Hence, it is not completely gone as a response, and we continue monitoring the evolution at the Syrian border and the end of the ceasefire. In Bekaa, Hermel, where we had already regular projects running that were providing pediatrics care, maternity support, ANC, PNC, all the sexual and reproductive health packages that were given to the population, plus chronic diseases. We had a huge cohort of chronic diseases. So the regular activities were open and they are continuing, but they're also absorbing all the different influxes of population that is caused by this movement, whether it is Lebanese people or Syrian refugees from the new wave or the previous wave. So our services are being scaling up today as we speak from what it was before during the war in terms of difficulty to access, plus being innovative and trying to localize the chronic diseases patients that are on the move everywhere to ensure that diabetic patients are not running out of their treatment and the chronic patients have access to their continued treatment. In addition to all of that, we are adding more mobile units to be able to respond to shelters that are hosting the displaced Lebanese where homes are destroyed, and also the new Syrian refugees that are coming, and the borders are still open and more people are coming by the hour. Hence, this situation is being monitored closely by our team. We are present in other areas also in the Bekaa governorate, where our teams are monitoring the changes in the movement of the population and proposing operational activities based on the current needs of this population. We have moved to the south of Lebanon, and we are trying to help in bridging access to health, knowing that all the structures, most of them were destroyed, ensuring that there is access to primary health care and doing a couple of assessments in relation to trauma, rehab, continuation of care for surgical patients, and primary health care in the areas that were completely destroyed and where people went back to settle, while monitoring closely the evolution of the context and the ceasefire, the 60-day ceasefire and results. In Beirut and Mount Lebanon, the majority of the displaced that were there left, and a small group remained. They are all consolidated in specific shelters, and they are still followed up by our teams. This response is not completely medical, so it's a mix between medical and logistics, where we discuss water and sanitation, we discuss NFI, we discuss dignity kits, and we discuss medical access, whether it's primary healthcare or stabilization and referral to existing locations, or doing secondary healthcare activities. We're definitely not working alone. We are trying to always exist with the Ministry of Health offer that is present in the country, knowing the challenges of the health system that was deteriorating before the war already. Hence, close collaboration is taking place between MSF and the Ministry of Health in the country in all its facilities, whether it's secondary healthcare or primary healthcare. Next slide, please. So that would summarize different points that I had to mention as we go, because this is happening today and it is impacting our decisions by the hour, as it's mentioned before. So what are the next steps? Yes, there's a ceasefire. However, the situation is not over yet, because the ceasefire is for a duration of 60 days. Any actor might decide to break the ceasefire, and this would impact a lot the situation on the ground. Hence, we are still monitoring closely. what's happening in Syria. We have also entered Syria, and we're trying to follow and monitor the situation closely and to respond where there is a need for us to respond. During the 60-day ceasefire, there have been ceasefire violations. It seems to be fragile. We are preparing in case it ends, so we're doing refreshments for APREPs, for lessons learned from the last couple of weeks intervention and follow-up, and to understand where is the system preparedness today and how we could be of benefit, knowing the scale of the destruction in those targeted areas. The teams are assessing and they are monitoring the needs with the change. The movement of the population is unpredictable. However, we are operating based on several assumptions and scenarios. As mentioned before, winterization, heaters, and blanket distribution in areas based on the movement of the population is one of our top priorities. Next slide, please. And that's it. I tried to provide a concise update. However, I'm available for answering your questions. Thank you.
Thank you, Tania. That was a very comprehensive brief on MSF operations in Lebanon. And I think the focus series participants would have a great idea on the current situation. I think we can now move on to the Q&A session to give you some questions. So the situation in Lebanon, in 2020, there was the bombing of a port in Beirut. And we did hear quite a lot about that in the press. And it was a country that suffered from an economic crisis for quite a long time. About 80% of the population is suffering from poverty, is one thing that I did also hear from the news. Even before this crisis, the overall basic infrastructure was very poor. And as you mentioned in your presentation today, due to the conflict and the recent developments, infrastructure has been destroyed. You have to take care of outpatient consultations and also psychiatric care. And the MSF is doing a lot of different operations. The medical healthcare infrastructure, if it's not functioning in the most basic way, then for MSF, what would be the priority or the most important principle that you have to abide by?
You have mentioned different events, right? So we started with the 2020, which was the Beirut blast that impacted a specific region in Beirut, where MSF was also part of the response. We have responded on the spot by assisting the existing resources. So indeed, the health system is deteriorating. However, there's an added value of the Lebanese system where you have the Lebanese Red Cross that is continuously present in terms of paramedical, like the ambulances, the wound care, the transportation of patients from the areas that are affected to the secondary healthcare facility. However, where you see the difficulty of the health system is in the continuation of care for those patients, for example. So if you want to do reconstructive surgery, or if you do a trauma intervention, it doesn't end in one surgical act. It requires more. It requires a follow-up and multiple interventions, and that's where the Ministry of Health system or support ends, and that's where there is an added value for additional support coming from international organizations to speak. And this was one of the how would say that it was one of the lessons learned that we took from the Beirut blast. What we did is we intervened in the first couple of days, and then we had a midterm kind of intervention that covered the vulnerable people that were targeted directly by this activity, and that was mostly targeting elderly and disabled with chronic diseases in that specific area, where you propose approaches that would work for those specific groups, like home-based care, for example. So MSF maintained this agility in proposing operations on the ground based on those scenarios. So if I want to bridge from your question about the Beirut blast and the vulnerability in the country, we do see that there is a continuous interest and serious work, at least on paper and through talks and through bringing and facilitating the work of international organizations on the ground by the Ministry of Health itself. However, because the needs are higher than the demands are higher than what is actually supplied, the system is still struggling. The socio-economical situation did impact a lot the access to care. Everything that was subsidized before, meaning the people having access to cheap chronic drugs, for example, today they're not as cheap as they were before, and if they want to have access to them in the pharmacies, they have to they have to spend more money, and health is not the one and only need for the population, as you have mentioned. So it's poverty impacting people's lifestyles and access to basic human needs, including medications that are also not affordable. Hence, lots of Lebanese people started seeking support from the system that was not ready to absorb all of those numbers at a certain period of time. And every couple of months, you always have an event that would shake whatever effort to stabilize the system, and then it would lead to more and more vulnerabilities. And that's where the added value of MSF comes, because we had already operations before the war, which helped us in responding to the Beirut blast at a certain moment. At the same time, we cannot target all the Lebanese population. We are not the Ministry of Health, nor WHO, if I may say. So we had our projects already positioned and accessible to the most vulnerable groups that we have followed through continuous analysis of the situation, whether they are migrant workers or Syrian refugees or vulnerable Lebanese in the areas that we are serving. Even when we have specific target population for our projects, we never refuse patients based on their nationality, religion, or ethnic or race. Hence, I would say that MSF has been there as an international humanitarian organization and a partner with the Ministry of Health, but we are definitely not involved in the structuring of the Ministry of Health and in the infrastructure. However, today, when we talk about the war and the intervention of MSF and how could MSF support the system itself in the restructure, we try to think of a sustainable solution when we are trying to plan post-war in a very fragile 60-day ceasefire situation, in a way where it could help certain structures in standing on their feet again and benefit from MSF's presence in terms of providing access, but also being able to continue providing this access on their own. But that would be, in MSF terms, switching from an emergency response to a regular kind of response. And that's there is a thin line between both when you want to work on programming.
So thank you for your answer. So I asked you, I mentioned about the Beirut, the blast. So I in Korean, I said it was not a blast. So I just wanted to correct my Korean that I used for the Beirut incident. Okay, I think you have explained about the situation in general. So it seems like you have different scenarios, and depending on your scenarios, you effectively and efficiently run the program. And in MSF focuses on emergency response, and you, as a partner, you are supporting the local countries so they can stand on their own feet. And also, and I think there are some situations when people, you also mentioned where people forget about the humanitarian situation in certain countries. The support sometimes declines. So you mentioned about Syrian issue, how the situation in Lebanon changes with the issue in Syria. So the turn of Syria has affected Lebanon, and the situation changing time by time. So I'd like to understand, are there any international organizations operating within Lebanon? So people are migrating within Lebanon, and it seems that I believe there are international organizations in Lebanon. Do you coordinate with each other? Like, I would like to understand how you coordinate with one another, how you like work together so it wouldn't overlap. Can you shed some idea?
Yes, totally. I would maybe take a word from your question to start talking about this. So since the escalations in Gaza last year, October 2023, the Lebanese Ministry of Health started coordinating responses, and us, Médecins Sans Frontières, so Doctors Without Borders, started coordinating and doing assessments and preparing for a potential escalation in the Lebanese side of this escalation. So what happened is that we were part of coordination meetings that involve the Ministry of Health and other actors that would be involved in potential responses. So if, as you might know, that this is not the first time that there is a friction, and this is not the first time where MSF also is part of a response when there is a conflict that's ongoing. Hence, there were a couple of scenarios that were prepared for. One of them is the displaced population. The other one is stabilization and trauma. The third one is providing secondary healthcare if the situation lasts longer and we start seeing more needs that are not covered or the system starts being drained. Hence, based on those scenarios, we as an organization prepared ourselves, and in light of all the discussions and the coordination meetings that we've had with all the other actors that showed interest as well, because they show interest to the Ministry of Health and they were part of those meetings. There was a coordination for a couple of months, and it seemed that the Ministry of Health on paper was ready in terms of dividing and conquering to be able to respond to the needs. However, what we have witnessed on the ground at the beginning of the war, MSF was the first to be able to reach the population in distress. And this is our priority. The priority is not to help structure the Ministry of Health in a country. The priority is for us to be able to reach the population in distress during an emergency phase. And if we could do that in a way where we could help in the restructuring, or we could help the system to stand on their feet, then definitely why not? Are we coordinating so that we don't duplicate? Definitely. Knowing that we are an emergency intervention, most of the time we are the first to respond, up until other organizations are ready, or their funding are liberated and they are ready to chip in. Whenever there's an interest by someone else to take over, we don't really argue. The added value of MSF is to be present where no one else is being present and there is a need to respond to. And we always take that into consideration. The same situation is happening now, that the displaced people went back to their targeted areas, like in the south of Lebanon, the southern suburb of Beirut, and also in Bekaa. And we still see a lack of mobilization of international organizations, even if they are present and they are attending meetings. But that is, in my opinion, it is related also to how quick MSF release resources to be able to respond to needs. And then you would have to continue monitoring to be able to decide what is needed, what would be covered, what are the remaining gaps when everyone steps up their game. And this really changes by the hour, as mentioned previously.
Thank you. As you mentioned, the initial intervention, the role of MSF is that you are the first responders, and we are always the first that try to get to the distressed population at the most fastest time frame as possible. I would like to ask the next question. So there is the 60-day ceasefire, as you mentioned. If the ceasefire ends and the war returns back to its escalation, then the mobilization of resources, medical supplies and such, would it be difficult to re-enter the borders after the ceasefire? So a lot of the access previously was also already very poor. And as you mentioned, and we already did see the video that winter is coming and that there are a lot of concerns with the upcoming situation. So with the siege of the borders, the potential situation of medical supplies not being able to be entered into the country. Are there any concerns on that?
In the first couple of weeks of this escalation, it was difficult for us to ensure security of our teams, and also the population was not really in safe zone. So it was difficult for us to access. However, it became doable after a couple of weeks, and this depends a lot on the intensive efforts that our operational teams are doing in terms of security measurement and also follow-up and communicating with all stakeholders and parties to ensure the security. What we're doing now is we're trying to benefit from this access to be able to prepare for any future evolution of the context where we could prepare properly. And this was done after the escalation in Gaza. Our teams worked with the hospitals and the Ministry of Health, and we did mass casualty trainings. We pre-positioned kits, so we did prepare for that. However, the replenishment of those kits took a little bit of time at certain moments because it was depending a lot on the shellings and the intensified bombardments that was putting everyone in danger. However, we maintained contacts with those partners, and now what we're doing is we are visiting them and we are ensuring that there is a plan that they could survive and that we could also through engagement with all parties, ensure that we have access, secure access to the areas that are in need. So I think it is an action plan that our teams are trying to secure for the future. And this includes also the importation of goods. And I mean, we can try as much as we can, but then at a certain moment, there are also unpredictable factors that we would still discuss and try to find solutions for. However, lessons learned from the past is a couple of weeks ago is definitely part of what we are working on today.
Thank you very much for your answer. I have a follow-up question. So we understand there are some targeting. I mean, they're targeting medical personnel sometimes. There are ongoing violence targeting medical personnel, which is very unfortunate. So there are about 78 medical personnel. And there are a lot more in Lebanon. You mentioned that the numbers of medical personnel in Lebanon. So in order to provide support and first response, I think what comes first is the safety of these personnel and activists. So you mentioned that. So I wonder, what are the specific protocols in place to ensure the safety of the MSF staff on the ground? And could you share how to ensure the safety of these medical personnel and also the staff?
So when we're talking about staff, if we only want to talk about international staff that are on the ground today, we have 80 plus people all over Lebanon. When I mentioned that it was difficult to access certain areas that were heavily bombarded in the south of Lebanon or southern suburb of Beirut, and this is because we didn't want to put our staff in danger, and we did not really feel that it was 100% secured, and then we had the proper coordination with other actors to maintain it. It took a little bit of time, and then we would not send teams unless we are sure that we could actually ensure their safety on the ground. So the safety of our staff, whether national or international, is our priority, and their well-being is also our priority. How do we ensure that? It's by having proper measures, having people who are following up on that, proper communication with other stakeholders, proper communication with the staff themselves, making sure that they understand the context and the challenges, the risks that we are taking, making sure that we are giving them the space not to go where they don't want to go, and to make sure that people, it's a consented movement, and that people have access to psychological support as well. We have our staff health unit that's providing individual sessions for people who are in need to be followed up. There are certain coping mechanisms as well that the teams developed in between themselves, and it depends really a lot on the management of the team, and also having some team space. We were based most of the time in areas that were secure in Lebanon, and where you had access to normal services for people to have dinner together, to have chats, talk, ventilate, and then refill their energy to come back the second day. That's how we managed it in Lebanon, at least. In terms of targeting medical staff, MSF did not face any targets in Lebanon. However, this happened in Gaza, and I'm not positioned to discuss this in this webinar. However, medical staff of local civil societies or paramedical teams were definitely targeted indeed, but we cannot, as an organization, elaborate more in this regard.
Yes, thank you for that detailed explanation as well. I would like to ask a different question. So on November 27th, the 60-day ceasefire was agreed upon. But still, after that, there have been small or still multiple incidents. So under these circumstances, 60 days seems to be quite short. Is it actually possible that this could be a prolonged situation that would go on for a longer period of time? MSF, as you mentioned before, is not planning for any type of vaccination or communicable disease type of programs in Lebanon yet. But if the displaced population has to face the poor conditions for a prolonged period of time, like limited access to clean water, are there preparations being made to respond to a situation in the longer term? And could MSF expand its support programs in that regard?
Yeah, I would just like to clarify when it comes to outbreak and management of communicable diseases. We were definitely prepared, and we were planning to escalate. It really depends on what type of patients are we seeing in the shelters that we're covering. But then when the people moved out of shelters, we couldn't really do anything because of the ceasefire. People moved, and then we're trying to track them out, and we're also moving our operations. This has nothing to do with our preparedness, as this is already part of what MSF does, right? So we are ready, definitely, it's part of outpatient consultation. So when you see patients, you would examine patients, and then you would have to be ready for their treatment. And when you have an outbreak, you will have to deal with it. You deal with it whether on your own or with the Ministry of Health or other actors that are part of it. It is definitely part of what we want to do. However, it really depends on the needs, right? So in terms of readiness, we are ready. Interest, we are definitely interested. We just hope that it doesn't happen. Are we ready if it happens? Yes. Do we think that this ceasefire might be broken? It's possible. We are preparing for all scenarios, and being an emergency organization, I think that's what we do best, right?
Thank you very much. So Tania is based in Lebanon, and the situation is changing day by day, time by time. And I'm so happy that we were able to have Tania in the midst of her busy schedule, busy situation. I have an interesting question. It's asked by one of the participants, and I think it's related to the situation in Gaza as well. For Lebanon, it was being the bombed by Israel like one way, and I think for MSF, neutrality is a very important principle. How can we maintain the principle of neutrality when Lebanon is the only one who's being targeted? Like it's like a one-way bombing. How can we maintain neutrality?
I didn't really get the question. One-way bombing? It was
Yeah,
not
so
a
it's
one-way
like,
bombing.
so the question was actually, they were saying it was one way. So maybe the power was not balanced. Maybe Lebanon was the weaker, that Israel is like powerful. So maybe it
Okay.
could be seen as a political issue.
I get you. So I will not go into politics. I could only talk about our operations in Lebanon because this is where we are based and that's the country we're covering, and those are the operations that I could represent. In our response in Lebanon, we do not really engage in political discussions or analysis. However, it is important for us to try to do context analysis to be able to have scenarios on the ground to be prepared for, right? And what we want to ensure in our response is first the safety of the people that we are that are working with us, and second access to healthcare for the people in distress. And in that situation, neutrality was on our top list when we were offering services not only to the displaced people but the host communities and the different refugees from different nationalities that were present and were in need for the support. I hope I answered you.
Yes, thank you very much. I think we do have another question in the chat from a participant. So we did talk about the Syrian refugees. So in Lebanon, there are refugees from Syria, but also other migrant workers from other countries and people who relocated to Lebanon. So I'm wondering if MSF is also working with any of such communities, and what would the situation be that you provide support to them?
As I mentioned before, the support that we were providing were for all vulnerable populations that were directly and indirectly affected by the war. However, before that, we already had programs that were also offering access to migrant workers or people from other nationalities that were using our clinics. Even when we have target population for our operations on the ground, we never say no for people coming from different regions of the world who happen to be in Lebanon and they are vulnerable and they are in need. And this is the same principle that was also used during the war intervention. So you might have seen or heard that a group of migrants that were working as domestic workers in Lebanon, for example, were left alone, and then they were staying in shelters, in different shelters in the area of Beirut. So they were supported also by MSF directly through. There is a clinic that is open only for them to ensure that they have access to healthcare, but also in terms of logistics, like NFI kits, hygiene kits, and depending on what are their needs. So, yeah.
Yes, MSF help people beyond races, beyond region, and our clinic is open to everyone, like despite their background. So Tania has visited online focus series despite busy schedule. And I'd like to ask you if you have anything you would like to share with the audience. Every time we have a focus series, Korea is definitely geographically far away from Lebanon. So what would you like to share to Korean audience? Like Korean audience sometimes are bummed, like how can we help Lebanon? We are so far away. So maybe you might have some words to share.
First, thank you for giving us the opportunity to shed the light on our operations in the region. There are lots of forgotten matters in this specific region and in Sudan per se. So maybe your next one should be also on Sudan. Thank you for the opportunity. And second, if I may share with you a request, I don't know, but I think it would be nice for the Korean population if they could would continue supporting MSF operations in different regions, and especially in this region. Having this support would help us in responding and ensuring and maintaining the proper and adequate responses in the field. And if there is any question or appetite to help the system in Lebanon in reconstruction, it's something that MSF doesn't really do, but maybe if you can advocate to have that type of support directed towards the reconstruction of the health system in Lebanon directly with the health authorities. This is what I wanted to say. Thank you.
Thank you very much, Tania. I think we can wrap up today's briefing with that. So Korea, as you may have heard, the circumstances are also quite turbulent at the moment. So we did hear about the humanitarian crisis in Lebanon. While it's happening in a remote location from Korea, we do actually want to show our support and interest. And this winter would be a little less painful for everyone. And I encourage you to continue to show care for the marginalized communities across the world. And I do think that we have a lot of participants who are interested in joining or either have questions about employment opportunities with MSF. So we have experts that are we are going to talk about logistics and also nursing experts that are required as very needed resources on the field. So if you have interest, please visit our website for the recruitment opportunities. If you have any other questions about our operations or recruitment, please visit our website. And we would like to thank everyone for taking your time to take part in the series today. We hope to see you in the next one. Thank you.